Experts in the fight against tuberculosis have called on the media and women in Nigeria to join forces in the education and sensitization of the public over the deadly but curable disease that causes stigmatization on both victims, survivors, and families. In a pre-Wtbd press conference on Thursday in Abuja, the Executive Director of KNCV Nigeria and Chair 2023 National Wtbd Planning Committee, Dr. Bethrand Odume, said 100% coverage is achievable should everyone galvanize efforts and provide the public the needed information about TB cure and treatment, thus urging the media to promote content that will enhance the people's knowledge to save lives as well as increase the nation's gross domestic products.
Tuberculosis remains a significant global health challenge. It is the world's deadliest.
March 24th, 1882 is the day the germ that causes TB was discovered, thus bringing to this auspicious celebration across the world as experts continue to canvass for more funding to upscale treatment and prevention. The theme for this year's 2023 Wtbd Day is Yes, We Can End TB, with the slogan Get Involved, aimed at reviewing the track record of TB contact tracing, diagnosis, treatment, and prevention, as Nigeria records 66% coverage in 2021. While speaking, the KNCV Executive Director, Dr. Bethrand Odume, noted that funding is the major challenge to closing the TB treatment coverage gap, contributing to the over-reliance of external donors on sustaining the TB program in Nigeria. He added that, despite the achievement, more work is needed to boost domestic funding through mass sensitization.
Participation in key TB program activities, raising awareness of such activities, including government policies and funder support. We also need to intensify advocacy to the government and the organized private sector to increase funding for TB program in the country. Funding for TB has remained a key challenge to support program activities towards closing the TB treatment coverage gap, which stands at 66% at the end of 2021. At a 69% funding gap and over-reliance on external donor agencies for funding, sustaining the TB program efforts in Nigeria will continue to remain a challenge. We will at this year's Wtbd Day celebration continue to reach out to governments and private sector operators to galvanize efforts at increasing domestic resources for the control of TB in Nigeria.
On his path, the World Health Organization country representative in Nigeria, Dr. Walter Molumbo, represented by Oyema Eyang, said TB is ranked 10 among the causes of death worldwide with a single infectious agent, noting that even though there is an increase in incident cases, the country needs more commitment to finding the missing cases of about 171,409 TB cases, as the disease is considered deadly than the HIV and AIDS.
TB is one of the top 10 causes of death worldwide and the leading cause of death from a single infectious agent, ranking above HIV/AIDS. Globally, there are estimated 10.6 million people with TB in 2021, with Nigeria and 7 other countries accounting for 2/3 of the global TB burden. In that same year alone, 1.6 million cumulated deaths were also reported. A large number of undetected TB cases constitutes a pool of reservoir that fuel ongoing transmission of TB in the communities. As one undetected infectious TB case will infect between 12 to 15 people a year. Additionally, the emergence of multi-drug resistant TB cases and the high number of HIV further complicates the burden of TB in Nigeria.
The worrisome aspect is that our children are also coming with tuberculosis. So we need to change the scenario, we need to change the narrative, we need to change our strategy. And so as a national program with the cooperation of the partners, we have put in some measures to increase our case notification and also to increase our momentum towards identifying tuberculosis among the children. Of the 285,000 missing cases we were able to identify last year, it was only 6% of them that were for children. And so we need to do more.
Earlier, Queen Ogbuji, the acting board chair of Stop TB Partnership and a TB survivor, Joy Simba, harps on the need for the government to increase funding and take the citizens' health its topmost priority to guarantee health for all, even as they call for personal advocacy to effect huge coverage.
We want to call on the government to put the health of its citizens as a priority. And in this instance, we are talking about increasing the funding for TB to close the huge gap existing so that we can reduce the burden of TB in Nigeria.
Why people shouldn't lose hope because they were told no cure to TB. Yes, it's deadly, but also curable. I have experienced the pain and discomfort that come with tuberculosis. And religiously for 6 months, I had my treatment and today I'm TB free. We can end TB by getting involved. Not just sitting and talking about TB, talking about funding. No matter the amount of funds we get, if we don't go out there to do the advocacy, it's nothing. I am getting involved today by doing one-on-one advocacy. We should get involved by pushing more human and non-human resources in communities, especially rural communities, where I think the high percentage of people still living with tuberculosis are because of their lifestyle, and this lifestyle can be a catalyst to the spread of TB. Let's ensure effective diagnosis and care procedure for people infected and at risk of being infected with TB. Let's encourage, as the TB Day is coming soon, we'll be doing a lot of outreach. Let's encourage language balance at healthcare centers and outreach, which is a strong barrier to creating awareness.
Over the years, partners in the fight against tuberculosis across the 36 states have converged in the nation's capital to brainstorm on ending the scourge. But this year came with different strategies as they vowed to take the message of the curable disease to the doorposts of the citizens to save the 6% of children affected at their active ages. Vincent Okushi, QTV News, Abuja.